Robyn Flynn filling in for Elias all this week with you from 9 to noon, Monday to Friday. Wait times for medical specialists have more than doubled since 2020 in the province of Quebec. Patients are now having to wait over 400 days, that's over a year, to see a specialist. And it's worse depending on the specialist you're trying to see. Need to see a dermatologist? Good luck with that. Waiting to see a gynecologist? Yeah, that's not happening for a while. Paul Brunet, patients' rights advocate, president of the Quebec Council for Patients' Rights, joins us now. Good morning, Mr. Brunet. How are you?
Good morning.
Why are we seeing wait times increase so dramatically? The government is just blaming COVID, but I feel like the situation is way worse in Quebec than it is elsewhere.
Yeah, well, listen, a lot of people have gone retired. Doctors have gone to private. We have a few hundreds who have left the public regime. But overall, it's not a matter of what should we think about that. It's how come that we've gotten to this situation. Don't tell me that the hundreds of people working at the health ministry who are planning specialists for those type of situation. I mean, the health system is big. We understand that. But a lot of people, very well paid, are doing planning. What have they done? We know that COVID happened. That's for sure. We understand that, but that does not excuse everything. And it's a record high. I mean, I've never seen personally with the 25 years and more of being a spokesperson for La Protection des Malades. I've never seen that kind of figure everywhere. Long-term facility, home care, elective surgery like we're talking about right now. A bed in a long-term facility, I've said it, a meeting or an appointment with a psychiatrist or a psychologist, it's gone from bad to worse, yes.
Yeah, definitely. I mean, just my own personal example, I spoke about this on the air yesterday. I received a referral from my GP. I'm a lucky Quebecois who has a GP. He gave me a referral for a dermatologist in September. I didn't get in to see one until February, and I didn't actually have my biopsy until June, and I am still waiting on my results. So when all is said and done, it'll be about a year to find out if I have skin cancer or not, which is horrible, absolutely horrible.
Have you checked with you? There is a way to get your reports normally, the results of your analysis on your own, carte d'assurance maladie internet dossier that you should have or should enter and try to get it from there.
Absolutely, because it seems like it's normal now to wait for results for months and months and months, and then you call and they're like, "Oh yeah, we forgot to call you." Like that's not okay. No, that's terrible.
Okay. And I still have some hope with the coming of Mrs. Biron and Mrs. Germain, the new heads of Santé Québec, to put some fresh air and thinking about outside the box, like we've been told that. From all the people who are working there for quite a few years, who have seated on different committees of experts, who haven't solved a lot of things, and we're still stuck with a lot of people waiting. So I still have hope with those new elements from the private. I'm not saying that for private. I'm just saying that we need some thinking outside the box, because what we've been told by experts being paid a lot of money, we haven't solved a lot of things.
Yeah, in conversation with Paul Brunet, patients' rights advocate, president of the Quebec Council for Patients' Rights, we're talking about wait times doubling to see a medical specialist right now in Quebec. Are you not at all concerned about Madame Biron's experience in the private sector? I worry sometimes because I feel like it's become accepted in Quebec that, if you don't want to wait, just pay to go private. And I don't think that that's necessarily the approach, because not everyone can afford that.
Well, if we saw or figured that either Mrs. Biron or Germain were coming from private, are slowly and secretly wanting to put more private. Personally, with the crisis that we're in right now, I don't care about if it's private doctors or public doctors who will operate me. I just want patients to be operated and that operation be paid by the state. For now, that's what I'm aiming at, because if we wait until we have a public regime, a strong public regime, we will not get it from a few years from now. So let's use every resource that we have, and for that matter, I hope that all these specialized clinics who have been authorized already to to do surgeries are fully occupied and under contract with the state because we need patients to be treated. I agree with all, the philosophy of a public regime. We all agree on that. But for now, I don't want people on the waiting list dying because we want to have a public regime, and until we do, that's not going to happen for the coming few years, I would say. So for now, I want every resources being used paid by the state so that patients be seen or operated by a specialist ASAP.
Yep, that's a really good point. Paul Brunet, patients' rights advocate. I'm always struck by, in the rare occurrences where I have paid for private medical care, how efficient they are. You walk in, you register. If your appointment's at 10 a.m., you're being seen at 10 a.m. Whereas in the public sector, your appointment's at 10 a.m. Good luck. You have to take the whole day off work, Well, can we learn something here?
A lot of money has been offered for healthcare providers to work outside the schedules, being paid, more overtime, so that we do, diminish the list. But apparently, the offer is not being received as well as we would have thought. But everyone should be reminded that if we don't settle this public regime problem of access, the pressure for the private to come and save, quote unquote, save us, is going to be even higher. We have to do all together, doctors, nurses, everyone involved in the system must work even harder and be ready for overtime and have private agencies being helping us. As a matter of fact, private agencies, why don't we use them where it should be good for them? Whereas, let's offer our public employees the good schedules, daytime, and tell the private agency, you come at night and the weekend. Yep. We should do that and help us with private agencies where we need them, not to replace our employees. And I hope that by doing so, we're going to keep our public employees and even attract more, because the real good conditions will be in the public regime, which is not the case as we speak.
Paul Brunet is a patients' rights advocate, president of the Quebec Council for Patients' Rights. Thank you so much for your time today, Mr. Brunet. Really appreciate it.